Hello, I am going to talk about this week's discussion, which is on acute coronary syndrome, which includes um, non-ST elevation MI and ST elevation MI and unstable angina. Unstable angina, I'll first talk about, occurs when your heart does not get enough blood flow and oxygen. It can lead to a heart attack. A lot of times people say it's a warning sign of a heart attack. Oftentimes it'll feel like you're having a heart attack. Which those common symptoms tend to be chest pain and tightness. A lot of people say it's like an elephant sitting on your chest, shortness of breath, especially with movement. You can have left arm pain, numbness, tingling. There are varying symptoms that one could experience, but those are often the common ones. So you can have those with unstable angina. Um, a lot of times, unstable angina will occur with um, stress or movement. So walking up the stairs, working in the yard, being really stressed out over something. Those are often times when unstable angina will occur. Unstable angina is not a complete blockage of the heart, which is what I will get to in a minute. Non-ST elevation MI can have varying degrees of reduction of coronary flow to the heart. It's not a complete obstruction again. It's just a partial obstruction. A portion of the heart muscle that's being supplied with oxygen is affected. And then with ST elevation MI, a coronary artery is completely blocked off by a blood clot or by plaque. It can be either one that's causing a reduction in the flow to the heart muscle, and that area rapidly starts to die. This is a more severe type of a heart attack and needs to be treated ASAP. So, when a patient comes into the emergency room complaining of chest pain or shortness of breath, typically the first thing that's done is the EKG. That needs to be done quickly, and we need to have someone who can read it and interpret it so a decision can be made as soon as possible. In the meantime, we'll often give patients nitroglycerin that will relax the heart muscle and decrease the workload on the heart, hopefully allowing a little bit more oxygen supply. A patient will be given aspirin to chew, which acts as essentially antiplatelet, given oxygen at varying liters just to increase the oxygen supply to the heart as much as possible. And then oftentimes the patient will be given morphine, again for pain and to help relaxation. When the results on the EKG have been read, a decision needs to be made very quickly on treatment. Um, it could be angioplasty, which is kind of like it snakes a little balloon through your artery all the way up to the area that's affected, and it can kind of, you can put a stent in there to just spread that plaque out if it's plaque, or a thrombolytic can be given to dissolve a clot. These ideally need to be done within 90 minutes to save as much of the heart muscle as possible. Every minute that passes is a little bit more heart tissue dying that is oftentimes irreversible and we cannot get back, which is where we get the phrase time is muscle, because every minute you waste is a minute of heart muscle that you oftentimes will not be able to save. There's also another kind of quote that's called a door to balloon time, which is the time a patient walks in the door to the time they get their balloon inserted. Um, and a lot of state regulations require 80% of cases for that balloon to be done in less than 120 minutes, which is often very hard because decisions need to be made fast, and nurses and doctors will have to prioritize and figure out quickly exactly what is happening with this patient, why they're having the heart attack, if the cause is a clot or if it's something like plaque or what's going on with the patient. So that is why where the phrase time is muscle comes from. I've seen this happen several times in the small hospital that I used to work at, where patients would come in and they would be having a STEMI, and the hard part for us is that we were actually a community hospital, so if we would take unstable angina patients, but if it was a true ST elevation MI, we'd often have to transport them because we did not have a cath lab. So we could give thrombolytics, but we would have to decide very quickly what exactly was going on with this patient and if we needed to transfer them. And if we had to transfer them, we'd have to include another, say, 20 minutes to 30 minutes in the time added on for treatment if they needed to go to the cath lab. So that's another reason why these decisions need to be made quickly. If an EKG can be done on the field, so the doctor can read it very quickly. That's a great thing. And so I've unfortunately seen patients who too much time had gone by and the results did not turn out as well as we hoped. So that is my discussion, and I will list my references below. Thank you.